In this video, we're going to discuss and demonstrate the vertebral artery challenge test. The purpose of this test is to assess for vertebrobasilar insufficiency, and a positive test is going to be patient signs and symptoms of nystagmus, any visual, auditory, or sensory disturbance, dysarthria, dysphagia, or if they have any sense of anxiety or panic. As I perform this test, I'm going to be positioning your head off the table and over to the side. Let me know if you feel any symptoms or if you start to see anything differently, hear anything differently, if you feel any sense of anxiety or panic, if you feel lightheaded, dizzy, if you feel nauseous, please let me know. If you're uncomfortable at any time, also let me know and I can stop at any time. Is it okay if I begin?
Yes.
All right. So how are we going to perform this test? We're going to have our patient move towards the end of the table with their head hanging completely off the table and completely supported with our hands. We're going to position them into marked extension. Now, not all the way to the end of anatomic extension, but just to where we would normally end with normal passive range of motion testing. And then we're going to rotate all the way near the end of that rotation to the left. Now again, not all the way to the anatomic barrier. We're not going to be forcing it at any point. We're just going to be gently positioning it to the left. And then with our patient's eyes open, we're going to be watching for nystagmus. We can also ask them if there's any visual or auditory or sensory disturbances, if they're feeling any nausea or any other symptoms. And then after anywhere between 10 to 30 seconds, we could bring our patient back to a neutral position and then test the other side. Again, extension, rotation. Again, not forcing any motion, but approaching near the end of where passive rotation would be. And then we'd observe for 10 to 30 seconds, observe for any symptoms, and ask the patient as well. And then we return back to a neutral position, and then get the patient back onto the table.